Your kidneys are like the body's super cleaners. They filter over 50 gallons of blood every single day. But what happens when they stop working? It's not just toxins that build up, it's a chain reaction that can shut your entire body down. Here's the step-by-step breakdown you need to know. The human body is a marvel of intricate systems working together seamlessly to sustain life. Among the many vital organs, the kidneys often go unnoticed until something goes wrong. These bean-shaped organs, located just below your rib cage on either side of your spine, are small but mighty, playing a crucial role in keeping your body healthy. But what happens when your kidneys fail? To fully understand this, let's break it down step by step, starting with what the kidneys do, how their function deteriorates, and the cascading effects on your body. Your kidneys are multitasking powerhouses. They filter about 50 gallons of blood daily, removing waste products, excess fluids, and toxins through the urine. They also balance electrolytes, regulate blood pressure through hormone production, and activate vitamin D to maintain strong bones. Without these essential processes, your body would quickly become unbalanced and unable to function properly. When the kidneys fail, their ability to perform these functions diminishes or stops altogether, leading to a condition known as kidney failure or end-stage renal disease, ESRD. This doesn't happen overnight. It's typically the result of chronic kidney disease, CKD, which progresses gradually as the kidneys lose their ability to filter blood effectively. One of the earliest signs of kidney failure is an accumulation of waste products and fluid in the body. Since the kidneys can no longer efficiently eliminate toxins, substances like urea and creatinine begin to build up in the bloodstream. This condition, known as uremia, can cause fatigue, nausea, and a general sense of feeling unwell. Additionally, excess fluid that the kidneys can't expel may accumulate in the tissues, leading to swelling, especially in the legs, ankles, and face. Over time, this fluid retention can put extra strain on the heart and lungs, making it harder to breathe and increasing the risk of heart failure. As kidney function declines further, imbalances in electrolytes like potassium, sodium, and calcium become a major concern. Potassium, for instance, is critical for proper muscle and nerve function, including the regulation of your heartbeat. When the kidneys fail, potassium levels can skyrocket, a condition called hyperkalemia. Hyperkalemia is not only uncomfortable, causing muscle weakness and cramping, but it can also be life-threatening by leading to irregular heart rhythms or cardiac arrest. Sodium imbalances, on the other hand, can cause confusion, headaches, and high blood pressure, while disruptions in calcium and phosphate levels can weaken bones and increase the risk of fractures. Another key consequence of kidney failure is anemia, which occurs because the kidneys produce a hormone called erythropoietin, EPO, that stimulates red blood cell production. When the kidneys fail, EPO levels drop, leading to fewer red blood cells and a reduced ability to transport oxygen throughout the body. This can cause symptoms such as extreme fatigue, weakness, and difficulty concentrating. It's a vicious cycle, as anemia further exacerbates the fatigue already caused by uremia and other complications of kidney failure. Beyond physical symptoms, kidney failure also has profound effects on mental and emotional well-being. Toxins accumulating in the bloodstream can affect brain function, leading to issues like memory problems, difficulty concentrating, and even confusion or delirium. This condition, often referred to as uremic encephalopathy, can be incredibly distressing for both patients and their loved ones. Additionally, the burden of managing a chronic and life-threatening condition often takes a toll on mental health, increasing the risk of depression and anxiety. When kidney function drops below 15% of its normal capacity, the body enters a critical stage where medical intervention becomes essential for survival. At this point, the kidneys are no longer able to support life on their own, and treatments like dialysis or kidney transplantation become necessary. Dialysis is a procedure that mimics the filtration process of healthy kidneys. There are two main types: hemodialysis, where a machine filters your blood outside your body, and peritoneal dialysis, which uses the lining of your abdomen as a natural filter. While dialysis can effectively manage the symptoms of kidney failure, it is not a cure, and it requires a significant commitment of time and energy. For some patients, a kidney transplant may offer a better quality of life. A transplant involves replacing the failed kidneys with a healthy kidney from a donor. While it's a more definitive solution compared to dialysis, it comes with its own set of challenges, such as finding a compatible donor, the risks associated with surgery, and the lifelong need for immunosuppressive medications to prevent organ rejection. Despite these hurdles, transplantation can allow many people to lead a more normal and active life compared to relying solely on dialysis. The causes of kidney failure are varied and often preventable to some extent. Diabetes and high blood pressure are the leading culprits, responsible for the majority of CKD cases. When blood sugar levels are consistently high or blood pressure is poorly controlled, the delicate blood vessels in the kidneys can become damaged, impairing their ability to filter blood. Other risk factors include a family history of kidney disease, chronic use of certain medications like pain relievers, and conditions like glomerulonephritis, polycystic kidney disease, or autoimmune diseases such as lupus. Preventing kidney failure starts with taking good care of your kidneys before problems arise. Maintaining a healthy lifestyle is key. Eating a balanced diet, staying hydrated, exercising regularly, and avoiding excessive use of salt and sugar can help keep your kidneys in good shape. Regular checkups are also essential, especially if you have risk factors like diabetes or high blood pressure. Early detection of kidney disease can make a significant difference, as interventions like medication and lifestyle changes can slow its progression and potentially prevent kidney failure altogether. For those already dealing with kidney failure, managing the condition involves working closely with a healthcare team to address symptoms and complications. This includes adhering to a specialized diet that limits salt, potassium, and phosphate intake, as well as monitoring fluid consumption to avoid overloading the body. Medications may be prescribed to manage blood pressure, control electrolyte levels, and treat anemia. Education and support are also crucial, as understanding the condition and having a strong support system can empower patients to take an active role in their care. Despite the challenges, many people with kidney failure go on to live fulfilling lives. Advances in medical technology and treatment options continue to improve outcomes, offering hope to patients and their families. Support groups, counseling, and resources from organizations like the National Kidney Foundation can also play an invaluable role in helping people navigate life with kidney disease. In conclusion, kidney failure is a complex and life-altering condition that affects not just the kidneys, but the entire body. By understanding the step-by-step breakdown of what happens when the kidneys fail, we can better appreciate the importance of these vital organs and take proactive steps to protect them. Whether it's through prevention, early detection, or effective management, there's a path forward for those facing kidney disease. Remember, knowledge is power, and taking control of your health today can make all the difference for a healthier tomorrow.